Welcome back to Your Daily Dose, the podcast where we make health information easier to understand so you can become the best advocate for your own health. Today, we're talking about something that affects millions of Americans every single day. You go to the doctor, you describe your problem, the doctor types on the computer for a minute, and before you know it, a prescription is waiting for you at the pharmacy. Now, before we go any further, I want to be crystal clear. This episode is not anti-doctor, and it is not anti-medication. Modern medicine has saved countless lives. There are medications that people absolutely need. I would know. My husband is a cardiac patient and he takes multiple medications a day, and those medications have helped to save his life. But if your doctor prescribes a medication, never stop taking it without asking them first. Instead, today's episode is about something much bigger. It's about making sure that the conversation doesn't end with a prescription. Because one of the most powerful questions a patient can ask is there anything I can do before adding another medication or before I take this? Sometimes the answer is no. Sometimes medication truly is the safest and best choice, but often there are additional lifestyle strategies that deserve to be part of the conversation. Today's episode isn't about blaming doctors, and it isn't about criticizing medicine, not at all. It isn't about encouraging people to ignore medical advice. No, not at all. It's about something that has become increasingly difficult in today's healthcare system, and it's time. The average healthcare provider wants to educate every patient thoroughly. They want you to understand, but time often gets in the way. And because of that, many patients leave the office, leave the hospital with a prescription, but without a full understanding of why they actually need it. What are the other options that may exist, and what questions should they ask? And what can they do to improve their health beyond just another pill? Have you ever left a doctor's appointment and thought, wow, that was fast? I know I have. Maybe you walked in with a list of questions, a notebook, or concerns you've been thinking about for weeks. You expected a conversation. Instead, you answered a few questions. Your doctor listened to your heart and lungs, typed on the computer for a few minutes, and before you knew it, there was a prescription waiting at your local pharmacy. If you've ever experienced that, you're not alone. I know I have personally. Now, before we go any further, I want to say something that's very important. This episode is not about blaming doctors. We love them. We need them. In fact, I have tremendous respect for physicians, nurse practitioners, physician assistants, pharmacists, nurses, every healthcare professional that dedicates their lives to caring for patients. Most people don't go into healthcare because they want to rush through appointments. They go into healthcare because they genuinely want to help people. So if that's true, why do so many patients leave feeling like they didn't have enough time to ask questions? The answer is complicated, but one word arises to the top, and it's often time. Today's healthcare providers are expected to accomplish an incredible amount during a single office visit. Think about what has to happen during an appointment that may only last 10 to 15 minutes. First, your provider has to review your medical history. They need to know why you're there today. They have to ask questions about your symptoms. They perform a physical examination on you. They review your current medications, and they look over laboratory or lab results or imaging, any x-rays or tests that you've had. They decide whether additional testing is needed. They enter all of this information into your electronic medical record on their computer, and they document every detail of the visit, not only for your medical record, but also to meet insurance and legal requirements. If prescriptions are needed, they send them electronically to your pharmacy. If referrals to other doctors are needed, they often help arrange those. And all of this has to happen while trying to answer your questions, explain your diagnosis, and make sure you understand the plan before walking into the very next exam room and starting over again. It's a tremendous amount of responsibility packed into a very short amount of time. Then there are the parts of healthcare that patients rarely see. Insurance companies often require extensive documentation before they approve your medicines, your tests, your imaging, or any procedures. Providers spend a surprisingly amount of time completing paperwork, responding to prior authorization requests, documenting quality measures, and meeting administrative requirements. These tasks are incredibly important, but they also take valuable time away from direct conversations with patients. Technology has helped healthcare in so many wonderful ways. I don't ever argue that. Electronic medical records allow providers to quickly review your history, see any test results you've had, communicate with other physicians or specialists, and it helps to reduce medication errors. But let's be honest, sometimes it feels like your doctor is talking more to the computer than to you. Many healthcare providers would tell you they don't like that either. This isn't what they envisioned. The computer has become an essential tool, but it can sometimes feel like another patient in the room, demanding the time and attention of your physician. Your Daily Dose podcast is supported by Often Crop Insurance, a family operated crop insurance agency serving farmers across North Carolina and the Atlantic region since the 1950s. Often Crop Insurance is built on trust and a deep understanding of rural communities. Just as this podcast helps patients better understand their health and navigate care with confidence, Often Crop Insurance supports agricultural families with simple conversations and honest service. Another challenge is that patients today are often much more medically complex than they were years ago. And let's talk about that. Many people aren't coming in with just one health concern. Unfortunately, they may have high blood pressure, diabetes, arthritis, heart disease, suffer from anxiety, have sleep problems, and several specialists are involved in their health care. They may be taking 10 or 15 medications that all have to be reviewed for safety and possible interactions. For every diagnosis, every new medication, every added specialist is just another layer of complexity to that appointment. And then there's something we don't talk about nearly enough: physician burnout. Healthcare providers are human beings. Sometimes we forget that. They carry tremendous responsibility every single day. I can't imagine. They deliver difficult diagnosis to people, to families. They often comfort grieving families. They make life changing decisions. They worry about missing something that could be very important. Many work long hours, complete documentation after clinical has ended, and they carry the emotional weight of caring for people during some of the hardest moments of their lives. Let's be honest, that is a lot. That kind of responsibility takes a toll. So when we talk about rushed appointments, I don't want us pointing fingers at individual providers. Now, we know some are better at this than others. I want us to understand the reality of the healthcare system that our medical providers are working inside of. I truly believe that most physicians want to spend more time educating and talking to their patients. I believe they want to answer every question we have. I believe they want to have longer conversations about nutrition, exercise, stress management, sleep, and lifestyle changes. I believe they want to get to know their patients better. I truly do. The problem is that our healthcare system often doesn't allow them to. So I want you to take that into account when you go into your next visit. And that's exactly why patient advocacy matters so much. Because while we may not be able to change the length of the appointment that we have, we can change how prepared we are when we walk into that room. We can ask thoughtful questions. We can bring a list of our medications. We can write down our concerns ahead of time. We can speak up when we don't understand something. And we can become active partners in our healthcare instead of passive participants. I want you to understand you are the most important person in your healthcare team. Let me say that one more time. You are the most important person in your healthcare team because the best healthcare happens when knowledgeable professionals and informed patients work together as a team. I want to take a few minutes to talk about something that I think is incredibly important, but that very few people ever hear explained. There are two terms that sound very familiar: patient education and patient counseling. Most people think they're the same thing, and I did for a long time, but they're not. In fact, they're very different. And understanding the difference can completely change the way you approach your healthcare and how you approach your very next appointment. So let's start with patient education. Patient education is exactly what it sounds like. It's giving patients information. Think of it as answering the questions of what, when, and how. Your provider might say something like this: Jessica, your blood pressure has been running high. This medication will help lower your blood pressure. Take one tablet every morning. You may experience dizziness when you first start taking it, so be careful when standing up too quickly. If you miss a dose, here's what you should do. That's patient education. We're all familiar with that. You're learning about your diagnosis. You're learning what the medication does, and you're also learning how to take it correctly, which is so important. You're learning about possible side effects, what to look for. You're gaining knowledge during this period of time, and that's incredibly important for you as a patient. Every person deserves to understand their diagnosis and their treatment plan. But education is only one piece of the puzzle. Now let's talk about patient counseling. This goes much deeper than patient education. Instead of simply telling you what to do, patient counseling begins by asking you questions about yourself. Because healthcare isn't just about treating a diagnosis, it's about treating a person. Everyone, even with the same diagnosis, is different. A provider who is counseling a patient might ask questions like this: Tell me about your typical day. What kinds of foods do you usually eat? How active are you during the week? Have you been sleeping? What kinds of stress are you dealing with right now? What concerns you the most about this diagnosis? Or can you afford this medication? Do you have transportation to pick it up? Will you remember to take it every day? Are you caring for someone else at home? Do you have family members who can help if you need it? Would you like to talk about lifestyle changes that might help improve this condition? Do you hear the difference? Education says, here's what you have. Here's what this medication does. Here's how to take it. Counseling says, let's talk about how this fits into your life. Education provides information. Counseling builds a partnership. Education is about knowledge. We all know that. But counseling is about understanding the diagnosis and how it affects your life. Education is often one way of communication, and counseling is a two-way conversation. It's individualized, it's personal, and it's collaborative. And perhaps most importantly, it gives patients an opportunity to be heard. Maybe you've been worried about taking another medication because you're already taking several others. Maybe you're concerned about the cost of your medication or your medical treatment. Maybe you've tried making lifestyle changes but haven't seen the results that you hoped for. Maybe you're caring for an aging parent or a child with special needs and you're already overwhelmed. Those things do matter. They may not change your diagnosis, but they absolutely influence the best treatment plan for you. That's what counseling is all about. And that is the missing piece in so many situations. It's taking medical knowledge and applying it to a real person's life. Unfortunately, counseling takes time, sometimes a lot of time. It requires healthcare professionals to really listen. It requires asking follow up questions. It requires understanding your priorities, your personal challenges, and your goals, and what you're concerned about. And time is one of the scarcest resources in healthcare today. That doesn't mean counseling isn't important. Please don't get me wrong. It doesn't mean you don't deserve it, because we all do. It certainly doesn't mean your healthcare provider doesn't want to provide it. It simply means that in today's healthcare system, counseling doesn't always happen unless patients help start the conversation. So here's what I want you to remember. Don't be afraid to ask for more than education. Ask for counseling. You might say, can we talk about whether there are lifestyle changes I should be making? Or you could say, is there anything I can do before adding another medication? Or can you help me understand how this treatment plan fits into my daily life? Those questions aren't being difficult. And I think we think that sometimes. They're being engaged, they're being informed, they're being proactive. And they're exactly the kinds of questions that create better healthcare. And let me say this too. I have not met a physician, a PA, a nurse practitioner, any medical provider, even a nurse that said, I wish patients wouldn't come in prepared. I wish they wouldn't ask so many questions. They want you to. And if you're initiating these conversations, they are going to be able to stay and listen. So the goal isn't simply to leave your appointment with a prescription. Now, if we have a sinus infection, something like that, that probably is our goal. Just recently, my daughter had strep throat. And so our goal in going to the doctor was not only for her to be tested and seen, but was to get her on antibiotics as soon as possible. The goal here is to leave with understanding, with confidence, and a plan that makes sense for you. That's the difference between patient education and patient counseling. And every patient deserves both. You know when something doesn't feel right. You know your priorities. You also know your concerns. Healthcare works best when patients become partners in their own care. I want you to feel empowered to ask questions, to take notes when you're in an office visit, and to bring someone to appointments with you. Keeping an updated medication list and speaking up when something doesn't seem right. Never feel embarrassed asking why. What are my options? What happens if I wait? Could we try lifestyle changes first? I want to challenge you with a question. How much research do you do before making a major purchase? Think about it for just a second. So, if you're planning a vacation, what do? You read reviews, you go online, you compare hotels, you look at the pictures, praying that's how it really looks. You ask friends where they've been and where they've stayed. We also watch YouTube videos, or at least I do. You check the weather. You make sure you're spending your money wisely. What about buying a car? Most of us spend weeks, sometimes even months, researching which car is best. We compare safety ratings. We look at fuel economy, so many different things. We read consumer reviews, and then we compare prices. We test drive different models. We want to know everything before we make that investment, that large purchase. So, how about buying a new television, a new cell phone, even choosing a restaurant for dinner? Many of us spend more time reading reviews about a restaurant than we spend learning about a medication we're about to put in our mouth that goes in our body. Isn't that interesting? Now, think about this. You leave your doctor's office, you stop by the pharmacy, you pick up a brand new medication, you get home, you open the bottle, take the first pill, and that's it. No questions, no reading, no understanding of what you're taking. But unfortunately, that doesn't surprise me. I've done it myself in the past because medications aren't like buying a new pair of shoes. They're substances that change how your body works. And while many medications are safe and very effective, every medication comes with important information that every patient should understand. Before you take a new medication, you should have a basic understanding of several different things. I'd like to take a moment to thank Brian Daly of Miller Grant and Company for being a sponsor of Your Daily Dose. If you're thinking about making a move in Central Florida, you need more than just a realtor. You need someone who truly knows the area and genuinely cares about your next chapter. That's where Brian Daly of Miller Grant and Company comes in. He specializes in Central Florida properties and has lived in nearly every corner of the region. From the heart of Orlando to the surrounding neighborhoods and communities, he understands what makes each area unique. The schools, the lifestyle, the restaurants, the hidden gems, and the places that truly feel like home. Maybe you're thinking of relocating to Central Florida. Brian can guide you every step of the way, helping you find the home you've always wanted. Genuine, knowledgeable, and committed to serving you, Brian Daly is ready to help you turn the key to your next home. Contact Brian at 919-222-0893 or email him at brian.daly@millergrantandco.com. First, what is this medication actually treating? Is it lowering your blood pressure? Is it helping control your blood sugar? Is it treating an infection? Is it reducing inflammation? Maybe it's to help you sleep or treat anxiety. Understanding the purpose helps you know whether it's working or not. Next, what are the expected benefits? How should this medication help me? Then ask about the risks or the side effects because every medication has them. That doesn't mean you shouldn't take it. It simply means you should know what they are. You should also understand side effects are common and mild, but others are rare and they require immediate medical attention. Another important question is whether this medication interacts with anything else you're taking. Could it interact with another prescription, a vitamin that you're taking, maybe just a supplement? It could be interacting with an over-the-counter medication. Even certain foods can affect how medications work. Did you know that grapefruit can interfere with several commonly prescribed medications? Most people have no idea. I know years ago, my husband, Brian, was on several different heart failure medications and we got a new prescription. And I won't ever forget this. We had gone to our appointment in a town about an hour and a half from us, and it was late in the evening. We went through the drive-through, and thankfully, we had done what I encourage you to do. We had gotten to know our pharmacist, especially if you have chronic illness and you're going to be using medication over a long period of time. It's great to have that connection. We pulled through the drive-through. The doctor's office had already called in the medication, and we pulled up to the window, and I remember our pharmacist said, "We've got an issue. I need you to know that the medication you were prescribed today could have a fatal interaction with a medication you're already on." So see, what had happened is we had a primary care physician for my husband, and then we had several cardiologists, we had a pulmonologist. They were all giving him different medications, and they didn't have a connected system. In this situation, the doctor prescribed something without looking for those interactions. In essence, our pharmacist that evening saved my husband's life. It could have been a fatal interaction. You should also know if there are any warnings or precautions on your medication. Sometimes people never read those. Maybe you're supposed to avoid driving until you know how the med is going to affect you. Maybe you should avoid alcohol with this medication, or maybe you should take it with food. Finally, I would love for you to ask whether the medication requires monitoring. Should you check your blood pressure at home while taking this medication? Should you monitor your blood sugar or your glucose levels? Should you be watching your weight? The more you understand, the more confidently you can participate in your own care. Now, let me be very clear. I am not suggesting that every patient become a pharmacist. That's why we have them. It's not our job. Pharmacists spend years studying medications, drug interactions, how to dose people, and medication safety. And I'm so thankful for these individuals. But I do believe every patient should understand the basics of any medication they are taking. Knowledge doesn't create fear. Knowledge creates confidence. And I love that. So, where should you get that information? Start with reliable, evidence based sources, places you can trust. I really recommend Medline Plus. It is a service of the National Library of Medicine and it provides easy to understand information written specifically for us, for the patients. Another source I love is the Mayo Clinic. They offer trusted explanations about medications, conditions, and also treatment options. And one of the best resources available may be someone you already see every time you pick up a prescription, and that's your pharmacist. We'll talk more about pharmacists in just a few minutes because I truly believe they are one of the most underused members of your healthcare team. But now let's talk about where not to get your information, or at least where not to get all of your information. Please don't rely solely on Facebook. Don't rely solely on TikTok. Don't assume that a random blog or an internet post is accurate just because it has thousands of likes or shares. And while friends and family usually have wonderful, good intentions, I want you to remember this: their experience is not your experience. Just because your neighbor had a terrible reaction to a medication doesn't mean that you will. And just because your cousin says a medication worked perfectly for them doesn't guarantee it'll work the same way for you. Every person is different and every medical history is different. In fact, every single human body is different. That's why it's so important to base your decisions on reliable information and conversations with qualified healthcare professionals, not just personal stories on social media. Now, let me say this: social media can be a wonderful place to find support, encouragement, and shared experiences. Let's be honest, you're on my podcast today, and this is brought to you through social media platforms. But it should never replace medical advice that's tailored specifically for you. Remember, your healthcare decisions deserve better than a 30-second video or a comment thread on the internet. They deserve thoughtful conversations that are based on trusted information and informed decision making. Because when you understand your medications, you're not just taking a pill, you're taking an active role in your health. Many people don't realize that pharmacists earn doctoral level training focused specifically on medications. They're experts in drug interactions, in dosages, and safe medication use. Your physician is the expert on diagnosing and treating disease. Your pharmacist is the medication expert. These two professionals work together in the best case scenarios, and patients should be talking to both of them. Questions to ask a pharmacist could be things like: how should I take this? Can I take it with food? What side effects should I watch for? Will it interact with my vitamins? What about my supplements? Can I drink alcohol? What if I miss a dose? Should I avoid grapefruit? Where and how should I store my medication? I want to spend some extra time talking about older adults because this is one of the biggest health literacy challenges that I see our country facing today. If you're listening and you're over the age of 65, this part is especially for you. But even if you're younger, don't tune out. Many of us are helping care for our aging parents, maybe your grandparents, maybe an older spouse, neighbors, or other loved ones. So, this information may help someone you love. Here's something that may surprise you. As we get older, our bodies change. Our kidneys don't always filter medications as effectively. Our liver may process medications slower, and our balance changes. Our vision has changed. Often our memory changes. Even the amount of water and muscle in our bodies changes. All of these things can affect how medications work. A medication that caused very few problems when you were 45 may affect you very differently when you're 75. Let's talk about a word that you may hear from healthcare professionals. It's called polypharmacy. That sounds like a complicated medical word, but the idea is actually pretty simple. Poly means many. Pharmacy refers to medications. So polypharmacy simply means taking multiple medications at the very same time. Many experts define polypharmacy as taking 5 or more medications, although the number itself isn't the whole story. There are people who safely take 5, 10, or even more medications because every one of them is necessary. The concern isn't simply how many medications you're taking. The concern is whether every medication is still needed, whether they're working well together, and whether the benefits still outweigh the risk. Here's how polypharmacy often happens. You see your primary care provider for your yearly checkup. Then you see a cardiologist for your heart, an endocrinologist for diabetes, a pulmonologist for your lungs, a neurologist, a rheumatologist, an orthopedic surgeon, maybe a gastroenterologist. Each specialist is focused on the part of the body that they know best. That's exactly what we want. But here's the challenge. Sometimes each specialist prescribes a medication without having the complete picture of everything another specialist has already given you. Thankfully, electronic medical records have improved this communication in many healthcare systems, but they don't always connect across different hospitals, clinics, or pharmacies. That's one reason it's so important to keep your own up to date medication list and bring it to every appointment. Before long, you may have one medication from one doctor, another medication from another doctor, a dosage increase from someone else, a new prescription after an emergency room visit, a medication from an urgent care visit, and before you know it, you're taking 10 or 15 medications every single day. I've even met patients carrying grocery bags full of pill bottles to their appointments because they weren't sure which medications they were supposed to be taking anymore. Think about how overwhelming that must feel. Now imagine trying to remember, did I take my morning pills? Was I supposed to take this one with food? Can I take these two at the same time? Which doctor told me to stop this medication? Is this refill replacing the old prescription? Or am I adding another one? It's no wonder medication confusion happens. And medication confusion can have very serious consequences. Taking the wrong medication, taking the wrong dosage, or taking medications at the wrong time, or maybe even accidentally taking duplicate medications. All of this can lead to significant and very serious health problems. Sometimes people don't even realize they're taking duplicate medications because the brand name and the generic are different. Or perhaps two medications in the same class were prescribed by two different specialists. That's why every new medication should be reviewed carefully. Another concern is falls. Falls are one of the leading causes of injuries among older adults. Many medications can increase the risk of falling because they make you dizzy. They lower your blood pressure. They give you blurred vision, and all of these cause problems with your balance. So one fall can change a person's life forever. A broken hip, a head injury, a lengthy hospital stay, weeks or months of rehabilitation, loss of independence. And sometimes it starts with something as simple as a medication that wasn't reviewed carefully. Memory problems also become part of the picture. The more complicated a medication schedule becomes, the easier it is to make mistakes. Some medications themselves can contribute to confusion, sleepiness, or problems with thinking, especially when several medications that affect the brain are taken together. So, I want to share a personal story now. For several years in the beginning of my husband's diagnosis, we would go to the cardiologist about once a week. And what I noticed after about 6 to 8 months was that my husband began to put on a large amount of weight. It wasn't his normal size. When we talked with a physician about it, he was very dismissive. At first, he said that we should think of gastric bypass or maybe Brian should stop eating. And it was very discouraging for Brian because I saw what was happening at home. I saw that he was actually eating less. I saw that he would often go days without eating, trying to lose weight. So, what I did was I took the list of his 12, yes, at the time he was taking 12 medications. I researched each one of them myself, and I found out that 8 out of the 12 would cause weight gain at the normal dosage. Well, here's where things got even more complicated. I found out that on several of these drugs, not only was he taking the recommended dosage, he was taking 2 and 3 times that amount of the drug. So that was raising his chance of gaining weight even more. 8 of these medications made him gain weight, not his habits, not his food intake. It was the medication. And so the next visit, I had all of this information highlighted and outlined in a folder for the physician, for the cardiologist, and I gave it to him. And I said to him, after you read this, I don't want you to ever say anything about my husband's weight gain again, because he's gained this weight because of the medications that you and other doctors have placed him on to try and save his life. So while you fat shame him at each appointment and make him feel so horrible about himself, it's all caused because of the medications that you have prescribed to him. And I won't ever forget the visit after that. The doctor came in, head held low. He looked at me and he said, Jessica, I read your research. I read over everything. I'm so sorry. And he looked at Brian and he said, I will never say anything to you about your weight again. I'm very sorry. So I tell you this story because we have to be our own advocate. We have to think about the drugs we're taking. We need to know the side effects. We need to know the things that can happen, even if we have to take them. So I tell you this to empower you. I tell you this so that you will research your health. You will research your medications, and then you can become part of the conversation, and you can also bring something to the conversation. Now let's talk about hospitalization. Do you know that medication related problems are a significant reason why older adults end up in the hospital? Sometimes it's because of the side effects. Sometimes it's because the medications they're taking are interacting with one another. And sometimes it's because accidental overdoses or missed dosages. And sometimes it's simply because no one realized a medication was no longer necessary. One of the most important things every older adult can ask is for a medication review. A medication review is exactly what it sounds like. It's an appointment or part of your appointment where every single medication is reviewed, not just prescriptions, everything. Prescription medications, over the counter, pain relievers you may be taking, any sleep aids, even antacids or herbal supplements, vitamins, even eye drops and creams that you're using. Because every one of those products has the potential to interact with something else. I also encourage older adults to ask for what's called a medication reconciliation. This is done at least once a year. Anytime you're being discharged from the hospital or see a new specialist, you'd be surprised how often those lists don't match up. A medication that was stopped years ago may still appear on the computer. A dosage may have changed. A specialist may have added something your primary care provider doesn't even know about yet. Taking the time to reconcile or discuss those lists can prevent dangerous mistakes. And finally, I want to introduce you to a word that's becoming more common in healthcare. It's called deprescribing. Now, deprescribing doesn't mean refusing medication. It doesn't mean throwing away your pill bottles. No, it definitely doesn't mean stopping medications on your own. Never. But deprescribing is the careful, thoughtful process of deciding with your healthcare provider whether a medication is still needed. Maybe a medication was started years ago for a short term problem, but was never stopped. Maybe your health has improved. Maybe you've lost weight, become more active, changed your diet, or successfully managed a condition in another way. Those are conversations worth having. Sometimes the best prescription is one less prescription. So let me leave you with this. If you or someone you love is taking several medications, don't assume that more automatically means better. Ask if every medication is still necessary. Ask if any medications may be causing side effects. Ask for a medication review. Ask for a medication reconciliation. And if appropriate, ask whether any medications could safely be reduced or discontinued under the guidance of your healthcare provider. Because good healthcare isn't just about knowing when to start a medication, it's also about knowing when it's time to take another look. I want to end today by talking about one of my own stories, a personal healthcare story. I never mind sharing those. I'm very transparent about it because I believe that when we share our stories, we help others. Probably about 8 or 9 years ago, I was not feeling well. And I went in for a regular examination, just a physical, a checkup. And I remember that when the nurse took my blood pressure, I saw her face. She didn't have a good poker face. I knew immediately something was up. And she said, Jessica, your blood pressure is really high. I explained, I said, I get really nervous when I'm the patient. And so that's probably why. So in a few minutes, the doctor came in and she proceeded to take my blood pressure. And it was still pretty high. Nothing life threatening, but it was just higher than it should have been. She had seen my family history. She knew that high blood pressure ran in both sides of my family and that both of my parents had been diagnosed with high blood pressure and both were on medication for it. She immediately took out her prescription pad and she said, I'm going to put you on a blood pressure medication. And I said, before we do that, is there anything that I can do? She paused and she looked at me and she said, well, sure, let's talk about that. She proceeded to tell me that I was about 30, 35 pounds overweight, which I knew. She also talked with me about my diet, which was horrible. And we also talked about caffeine consumption, which was super high with lots of coffee and Diet Coke. And then we also talked about my stress level. I shared with her that I was the primary caregiver for my husband and that I also worked full time and was a mom and all of these things. After we talked for just about 10 minutes, she looked at me and she said, if you really want to try to do this without medicine, I'll give you 1 month. She said, I want you to make these changes we've talked about. I want you to lose weight in a healthy way. I want you to improve your diet. And I want you to check your blood pressure every morning and every night for a month and then come back to see me. I really got serious and I began to think about what I was eating, think about what I was doing. I began to move my body, eat better, lost weight. And in that month after I went back, I had lost about 10 pounds and my blood pressure had come down considerably. And she said, if you can continue this pattern, there's no need for you to go on medication. But if you ever have an issue, let me know and we'll address it again. I just share that with you because that was that difference between the patient education and the patient counseling. I had to be the one to initiate that conversation. I was the one who started and got the counseling going. Now, in some situations, doctors will tell you, we've got to put you on a medication right now because your condition, your blood pressure, whatever, is at a really serious situation. And so you may have to go on medication and then later, after lifestyle changes, can come off of that medication. So talk about that too. I want to end today by addressing something that I've heard many patients say. They believe that asking questions could offend their healthcare provider. But most healthcare providers appreciate engaged, informed patients. They love it and they welcome thoughtful questions. If you remember only one thing from today's episode, let it be this: never be afraid to ask one more question. One more question could prevent a side effect. One more question could prevent a dangerous interaction. One more question could help you avoid taking a medication you may not need. One more question could improve your quality of life. One more question could even save your life. Your doctor is an expert. Your pharmacist is an expert, but you are the expert on your own body. Healthcare works best when all three work together. I want to thank you for listening or watching this podcast today. I hope that something that I shared will impact your health in a positive way. I want you to feel better. I want you to enjoy life, and I want you to improve your quality of life. That's what this is all about. So thank you so much for being with me today, and I'll see you next time.